So I'd like to begin the meeting today, March 1st, 5 p.m. Um, the gang's all here. The board members are all in attendance. Kristen Kennedy, Tim Myers, and Mark Taylor. In keeping with the ongoing order from Governor Charlie Baker to limit gatherings and maximize social distancing, and under legislation passed to address remote board meetings during the emergency declaration, this meeting will be conducted over Zoom. Attendance by board members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on eCat. To join a remote meeting using your computer, click on the URL at the top of the meeting agenda or copy it and paste it into your browser. To join a meeting using your phone, call the number provided underneath the URL. You will be needing the meeting ID to join by phone only. And just a reminder, if anybody is going to make any, ask any questions or speak, they just need to let us know their name and address. Okay, so Kristen, you were gonna do an update?
Yep, let me just get the screen share up, and here we go. Okay, why is my mouse?
It's Monday.
I'm like, I'm using a wired mouse. Why is it not doing what I want it to do? Okay. Huh. All right, can you guys see my screen share?
Yes.
Okay. All right. So let's go to the slideshow and let's go back to the beginning. All right. So good evening. Today is March 1st. I am Kristen Kennedy, the Director of Health and Community Services, and I'm here to provide a update. So we usually start with this slide. I'm going to have to start adjusting the upper date range in order to get it to fit on the page. But I think we're at a point where it actually is really going to show a nice illustration on where we've been and where we're going. As of the data pull last week, which was through February the 20th, the data pulls go from Sunday through Saturday, and they pull them the following Wednesday because it takes a little while for a lot of the test results to get entered into Maven. But as of the 20th, we had 1,704 confirmed cases of COVID-19 since this began on March 12th. Easton's average daily incident rate is 28.9 cases per 100,000, which is one of the two factors that we are on the upper side of that is keeping us in the yellow right now. There are two, as you can see from the chart below, there's two categories that are looked at for our population. One having a average case per 100,000 of 10 or more, or having a positivity rate of 5% or more. If you look at the chart and we go back to, I had started this chart with the data beginning November 1st, initially as an illustration to show what happened through the holidays and to show the spiking of cases, as well as to see the impact of what happens when Stonehill's robust testing is not being done and our average daily tests numbers fall. But we're kind of right back up where we were at the very beginning, with our number of tests even being a little bit higher, but our positivity rate has gotten right back down to 1.53. The thing keeping us in the yellow is this positive. We are, for that date period from February 7th through February 20th, we had 111 positives, which put us into an average daily incident, as I mentioned, of 28.9 per 100,000. We do continue to see spread in households. We're seeing quarantines resulting from sports exposures, and we're seeing some quarantines that are being done after travel, but for the most part, the majority of the spread that we're seeing is in households. What else is new? As of last week, Governor Baker made some more sweeping announcements. One being that as of today, we are back into phase 3, step 2. If you remember when we saw the surge around the holidays, the governor put us back into step 1. And now, given the way that the numbers are trending in a positive way, there's a comfort level at the state to move forward and to increase some of our capacities and some of the things that are being allowed to go on. So right now, as of today, indoor performance venues such as concert halls and other indoor performance spaces can go to 50% capacity with a 500-person maximum. Indoor recreational activities like laser tag, roller skating, trampolines, they can open at 50% capacity. There's a whole list in front of you of other industries that now had gone from, I think, a low percent to 40% and now up to 50% for indoor capacity. One of the things that we're still waiting for updates on is this last quarter category over here, which has to deal with the EEA industries, and that's youth sports that are not associated with schools. So we're expecting some updates from them that aren't available yet. Effective also today, fitting rooms can open in retail businesses once again. One of the most impactful that people think about as we go to our workload and what's going on in town for us is the restaurants, the changes in the restaurant requirements that went into effect today. So as of today, there is no longer a percentage capacity being placed on our restaurants. They are only limited, as they were prior to this phasing back, to their ability to separate tables by at least 6 feet. They are still limited to no more than 6 people in a table. They are still limited to a 90-minute service time. They are now allowed to have musical performances in restaurants with appropriate distancing. One key clarification here is musical performances are just that, music. They are not singing. There is still no singing allowed indoors in a restaurant. Food courts, which don't really pertain to us, also remain closed. As we start to move through, I just carried this slide over. We saw last week that the eligibility now of those 65 and older and those with 2 or more specified medical conditions are now eligible for vaccination. But as I told you the last time we spoke, on February 17th, Secretary Sutters issued a letter to us public health professionals detailing a bunch of different things, which included that first dose distribution to municipalities would stop today. We are anticipating the delivery tomorrow, we hope, of the second doses that we had planned to administer tomorrow. Our clinic did need to be rescheduled due to a shipping issue and a delay in us receiving the vaccine. We have been told that we will be supplied with the vaccine to inoculate the residents at the Housing Authority in the coming weeks, which is good news. And we're also being asked to gather data on homebound residents. And we are told further information will be coming in the middle of the month about what type of models the state is looking at for us to be involved, or for private entities to be involved in actually vaccinating those homebound residents. So more to come on that one. Big news over the weekend, a 3rd vaccine was approved. It is a single dose. And we hope to see that makes a big impact. The first doses, I believe, hopefully we're getting shipped out today. So we will hopefully hear more in the coming days as to how that will impact Massachusetts' ability to get more residents vaccinated. One of the most, I know in one of our last meetings, I had been asked a question about, which vaccine or waiting for a different vaccine. And I thought this was a really interesting slide that Dr. Jha out of Boston actually Brown University School of Public Health. You see him a lot on the morning shows. And he tweeted this back on January 31st. The numbers are actually higher now for people that have received the vaccine. But the very important, most important statistic, when you look at no matter which vaccine it is, nobody who has been fully vaccinated has been hospitalized. Nobody who has been fully vaccinated has died of COVID, and nobody who has been vaccinated has perished or fallen to the actual vaccine itself. So all good news out there as far as the vaccine and its efficacy and its ability to prevent severe illness and death. Ongoing efforts, they're pretty much the same as we discussed last week. We continue to meet twice a week, the executive team, to talk about updates and plan for upcoming challenges. We meet daily with the school administration. Tim is now up and trained on Maven. The COVID website continues to evolve and continues to be our main method of getting information out to the public as these things are changing. And as I said before, we're working on identifying homebound individuals for future vaccine efforts. And that is it for me. I don't know if anybody has any questions.
Then I have a question, and I didn't think of it till you had read off one of the slides. There's been no change to youth sports, but with all these changes recently, with the kind of opening up of things, school sports hasn't changed, has it? Because I hadn't heard that there's been any changes.
No.
Okay.
Not that I'm aware of. As I said, they have been teasing that more is coming, and I even had a conversation with one of the individuals up at EEA and asking about a specific scenario that we were working on, and there was a cryptic, but things could change. So we have our meeting tomorrow afternoon with the Department of Public Health. I am hopeful that maybe they will give us a little bit of a heads up if there is anything changing. One of the things that did come out as part of this approval is the tickler as to us beginning the next phase, which, if the public health data continues to track the way it is set to occur on March 22nd. And one of the little pieces that was in that press release was that this summer overnight camps could anticipate operating. And that's where that EEA would come into play as well. That I think we're going to see some changes, whether or not they'll be effective prior to the 22nd or whether or not we'll get them closer to the 22nd. I think that there is going to be some changes in the guidance that hopefully gives us a better clue as to what to look for spring.
Okay.
Kristen, I have a question. Do you think that now that Johnson & Johnson is approved and is online, do you think there'll be an amendment to the municipalities not receiving vaccines?
So we remain hopeful. The town administrator, the fire chief, and myself submitted written testimony last week to the committee that is reviewing the vaccine rollout for the Commonwealth. And we echoed, I think, the sentiments of a lot of municipalities, which were that, it doesn't need to be mutually exclusive. We accept that there is a value to the high push through sites and their efficiencies, but that there are subtleties to all of our communities that we would like to be able to address. We also, in our written testimony, expressed our interest that we would like to be the ones to be able to provide the vaccine to our staff as they come online. I know we're a little ways away, but when the educators and school staff come up, I strongly believe that we would be the most efficient way to get the vaccine into staff's arms quickly. And that's just balancing off our ability to do 250 to 300 vaccines in a day, standing on our heads, tailored to the times that work for the school department, versus 600 teachers scrambling to get vaccines on those platforms and then potentially having to make a choice between missing instructional time and going to get their vaccine. I just think there's an efficiency there in that we can plan around the instructional periods and not have educators who are, I got an appointment Tuesday at 6, at 10 a.m. Do I teach or do I go get my vaccine? And hopefully eliminating some of that. So we remain hopeful that as the amount of vaccine flow is flowing back into the state, that those are some kind of realistic things put back on the table, as far as that we're putting back on the table, that, we get that this is the most efficient way, but there are certain populations that it probably would be more efficient, if not kinder, for us to be able to handle. So we continue to lobby that front.
Excellent. Thank you.
And along those lines, do you have any idea when that next group, including educators but not limited to just them, might be eligible for vaccination?
I don't have an inside track on, nothing has come out at any of our meetings. I think hopefully in the next week, when you start seeing the shipments of the J&J coming out, the fact that it is just the one dose, the fact that it is much easier to transport, and whatever is in the supply chain ready to come out, we'll see. Hopefully we'll have some more information, and things will, as we've said, and as the government has said, as more vaccine comes online, the faster we can move with these. So hopefully it won't be that far.
Ooh. Any other questions? No? Thank you very much.
No problem.
A
As
lot happened,
always,
but-
if any questions come up, as you guys are out in the community, or if the community reaches out to you, get them to us. And especially if it's something that needs to be up on the website that we're missing an opportunity to get information out on, that people are truly looking for and having a hard time finding, we want to make those corrections.
Actually, this actually is kind of timely. I was asked to where people could look for assistance, and I went on the website, and I know we have stuff on the Board of Health website for like veterans and the Council of Aging and food pantry. Is there one centralized phone number to call for that?
Assistance relative to their COVID situation?
Actually, financial problems, that kind of thing. Is there, I think a lot of people call and they're just in a bad way, whether it's COVID and that's affecting finances or, whatever. And when I was looking through, and maybe I missed it, I felt like it was like different groups, and maybe I missed a phone number that somebody could just say, here's my situation.
Yeah, it would be best to come through the COVID line, and then we'll get it over to the department. More than likely, if it's finance related, it's going to stay within Health and Community Services. And depending on what the actual issue is, it would probably go to either Deputy Director Ahonen for financial services, or Deputy Director Daly for programming. And programming can cover things such as the Housing Authority and pieces like that. So coming through the COVID line gives us an opportunity to screen it, and we'll have somebody get back in touch with them, either with resources through one of the deputy directors, or through either Nicole or Kelly.
Okay. All right, I did see that there, so I'll know, I'll spread the word. Anybody else? So we can maybe make an emotion to adjourn the meeting? March 1st at 5:20 PM.
Seconded.
All those in favor?
Matthias, yes.
Mills, yes.
LeBlanc, yes. Thank you guys so much.
Thank you.
Have a good night.
You too.
Bye.